I know that lots of people either have lung cancer or know somebody who has lung cancer. So I figured it'd be a little bit of a public service to describe what it is that I was learning as I was learning it.
Hello and welcome to the Dragon Tree Podcast, the show where we talk to great communicators about how they do what they do. I'm your host, Chris Hobson, and today we're speaking with radio broadcaster Neal Augenstein. Neal is a multimedia journalist, mobile journalism trainer, and has been a general assignment reporter with the local Washington, D.C. radio station WTOP for our local listeners since 1997. Because of his unique voice and insightful storytelling, Neal has been dubbed the voice of D.C. We'll get to this shortly, but in November of 2022, Neal was diagnosed with stage 4 lung cancer, which for many people actually, and we'll get into, in recent years, maybe not so much, but in the past has been sort of an incurable diagnosis once you get to stage 4. But after robotic-assisted lobectomy and targeted therapy, Neal is now cancer-free. Since November is Lung Cancer Awareness Month, we invited Neal onto the show to talk about his journey and how along the way he's actually been very effectively communicating about his road to recovery to a wide audience. Neal, thank you so much for joining us today.
My pleasure for being with you today, Chris. Really is.
Excellent. Well, for those in the audience, there are probably only a few of them, but who may not be familiar with your work, can you please give us a little background about your time in radio?
Sure. I studied broadcast journalism at American University here in D.C., and that's how I learned a little bit about journalism. But even before that, I wanted to be a DJ. So I practiced spinning records at home. After I graduated college, I realized that I thought that radio news was going to be too much politics, and I don't really care for politics very much. So I thought, boy, I made a mistake in getting into broadcast journalism. So then I veered into talk shows as a producer of radio talk shows. Eventually, when that job ended, there were some positions in radio news, and I figured I would take a little time and try my hand at that. That was back in 1993, and so I've been doing radio news ever since.
And has that whole time been spent in DC, or did you knock around other places, or have you always been local?
Mostly in DC. I started at United Press International, UPI Radio, back when they had an audio service. For a little while, I was producing talk shows. One of note was Morton Downey Jr., who's sort of a well-known antagonist talk show guy. And after that was when I started getting into news, starting as a producer, learning the basics that I'd learned back at AU in broadcast journalism, putting them into usage, mostly behind the scenes, and then eventually as my own work started being on the air.
Well, thank you for that great intro. And if we could now turn to talking about, in particular, your lung cancer story. In the fall of 2022, as I mentioned, you were diagnosed with lung cancer. Could you please talk a little bit about that experience?
Sure. It was, I guess it's 2 years ago now. I was coughing. I'd been coughing for several weeks, and I wasn't quite sure what was going on. I started Googling, the possibilities. I saw my doctor, who thought it might be bronchitis or pneumonia or allergies or something along those lines. And all of the tests and the antibiotics and the other things that I tried didn't work. So as a couple of weeks turned into a couple of months, I started, seeing the possibility that lung, an unexplained cough is sometimes lung cancer. So I went back and forth between thinking, well, it's nothing. I never smoked. I don't have cancer. And I went back and forth between that and saying that the cancer is I not only have it, but it's spread through my entire body, and I'm doomed.
Right.
So the period of time in between when I started coughing and when we found out what the diagnosis was the most difficult time for me. In November of 2022, I finally had a bronchoscopy with a biopsy, which is a tube down my throat into my lungs, and that's where the doctor told me that based on what he saw, both in the microscope and in the operating room of looking at the X-rays or the CT scans actually of my lungs, he was pretty sure that I had something called non-small cell lung cancer, a particular type called adenocarcinoma, which is a slow-growing type of cancer. And so on that day, the day that I had the bronchoscopy, I learned that I had lung cancer.
And yeah, you talked about the slow growth nature of the I guess tumor, if that's the right way to say it. And I think if my research is right, it was actually the cancer mutation that you particularly had was positive for and I'm going to ask you to help me a little bit with this, but epidermal growth factor receptor, or EGFR, is that right?
You did it better than I ever. I would not know what EGFR stands for. In fact, the first several times that I said those initials, I'm sure I mixed up the G and the F.
That's right.
So good job getting EGFR done. Now, the way that we knew that I had EGFR is very important. Perhaps the most important moment in my lung cancer journey. While I was while the doctor was gathering the biopsy, which they looked under the microscope he was able to tell that it looked like non-small cell lung cancer. While I was still asleep, that biopsy, that specimen, was being sent for something called biomarker testing. And what biomarker testing is, it's a very precise examination of the exact kind of cancer that I have. The reason why that's important is that doctors can now, if they can identify that I had a certain kind of cancer that had that reacted to something called a targeted therapy, that would be effective in my treatment. Just a reminder that chemotherapy kills cancer cells, but it also kills healthy cells. What targeted therapy does is it only targets those specific cancer cells and leaves the rest of your body alone. And so the effects of that are, it almost can't be described how much easier, how much gentler targeted therapy is on most people's bodies than chemotherapy. Not everybody's. Some people do have, so for some people, the side effects of targeted therapy are quite uncomfortable. But in my case, having that particular, it was EGFR exon 19 deletion. I have no idea what that means. I just know that that's my kind of cancer, and luckily for me, there is a targeted therapy that zooms right in on that particular kind of cancer. And also lucky for me, that particular cancer is one of the most common types of cancer there is. So there's a lot of research going on to find cures and treatments for EGFR mutated lung cancer.
Yeah. And I was struck in my research when I was reading about your story, how recent a lot of these breakthroughs have been, and thankfully, in your case, I know, and we'll get to your care team in a minute. But I know at least one of the one of the doctors on your care team has been working in a subspecialty that just was created like, I don't know, 15 to 20 years ago, right? So this is all, hopefully that puts it in a little bit more perspective for the audience. This is all very recent. So, and just the fact that you had to kind of endure that not knowing, from the time of your diagnosis until you put your care team together, it must have been very harrowing. So thank you.
Well, the what is nice about it is that the moment when I heard that I most likely had lung cancer, before if you'd asked me 10 minutes before, I would have said to you, if I ever hear that I have lung cancer, I don't know what I'm going to do. I'm not going to be able to handle it. Within minutes of the doctor saying that uh, we're waiting for the biopsy, but we think that you have this lung cancer. He was telling me about the plans that were already in place for my treatment.
Oh, that's
He told
interesting.
me that the biomarker testing had already been sent out, and that we were going to have an appointment with my oncologist and a surgeon within 3 days, and during that 3 days, they'd be gathering more information about the specifics of my cancer, so that when we got together in this meeting in 3 days, that would be when we would, when we would determine what the specific kind of treatment was. As you probably know, once you get diagnosed with cancer, they do what's called staging, which is to see how far the cancer has spread, if it has, and to where. And those facts play a big role in what the treatment is going to be. Like, for instance, if it had just been in one of my lungs and a lymph node in the middle, then I would have had chemotherapy and radiation, and that would be uh, considered stage 3 cancer, and radiation and chemo would be the treatment. I knew beforehand that if it had spread elsewhere, that would be considered stage 4. And after having a CT scan, which looked at the rest of my body, and having a PET scan, or actually a brain MRI to see whether it had spread to my brain, and also a PET scan to look throughout the body to see if there were any hot spots, anything that looked like cells that were multiplying faster than they should be, which is what cancer is. Um, After having all of those, it was determined that I had cancerous tumors in both lungs and in lymph nodes in both lungs. So while it was all contained in my chest area, that was considered stage 4. And I knew from that meeting with my doctor that this treatment would be this targeted therapy. It's called osimertinib, which he told me was very effective in treating it. Usually very well tolerated by people who take it. Thankfully, I'm in pretty good shape. I wasn't feeling any symptoms of cancer besides the cough. Some people when they get diagnosed, they're already having pain in various parts of the body. Thankfully, I didn't have that, and being relatively healthy, I think that made it easier for me to handle the treatment and the whatever side effects there were.
For sure, and also what strikes me is the the speed at which your team was kind of put together, and you were already kind of on a care pathway. I think you said within 3 days. Is that what you said? 3 days? Because I just having worked with physicians in this area in the past, I know that depending on where you are geographically in the country, things don't move that fast. So just because we may have viewers or listeners who are from kind of all over, that I think and you even say this in some of the articles you wrote. You're so thankful that you had a great team, but you're also so thankful that you live in an area and you have the kind of insurance that lets you do this, and you have kind of really good hospital system and things like that. So
Well, and
just
that
this
and that
background.
that's an excellent point. I think that that anybody who gets diagnosed with cancer, I think it's very helpful to be in a cancer treatment facility, or be treated by a team. These days, the most effective cancer treatments at the comprehensive cancer centers around the country have a team, a team approach. So the oncologist works with the radiologist, who works with the pathologist, who works with the interventional pulmonologist, who's the person who goes in and does the bronchoscopies. And they're all tied in together. All the records are shared, so that um, so that they come up with a plan. I didn't know this when I started, but there's something called a tumor board. And when somebody is diagnosed with cancer, one day a week, or 2 days a week, whatever, all of the experts gather in, it's probably a Zoom meeting or something like that, but they gather and they discuss a newly diagnosed person, and they come up with what would be what should we do for this, with this particular tumor. And to me, having a tumor board, putting all of those great minds together, thinking about what would be best for me, to me was very empowering and encouraging, knowing that that some really good minds were thinking about what would give me the best chance to do well with my treatment.
Off the top, you talked about how you really had no history of smoking at all, and how you were kind of surprised by the fact that you could have even had lung cancer. And I know there's a lot of people who have the misapprehension that only people who smoke cigarettes or who maybe around people who smoke cigarettes can get lung cancer. But that's one of the aspects of your story that I find so interesting, is that you don't have any history. So can you talk a little bit about how that's possible? And I believe there's a family history on some level, correct?
You are absolutely right. My father did have lung cancer. He smoked until I was probably about uh, 12 or 13, and my mom
Oh, okay.
did too. But so my dad did have a smoking history. So I was exposed to some secondhand smoke. But with my particular kind of cancer, EGFR, the doctor said there's no indication of how I happened to get it.
Oh,
Sometimes uh, people who smoke a lot, or who are exposed to a lot of different secondhand smoke, often don't usually do not get EGFR.
oh,
EGFR is the kind of cancer that non-smokers tend to get, and surprisingly, a growing number of young people, non-smokers, uh, are getting diagnosed with EGFR. Um, that is something that, why that's happening. That's what researchers are still trying to determine. That there's question about whether radon is a cause. I did check my house, and there was no indication
oh.
of radon there. So you know how I happened to get cancer, how my genes started to misfire, that's just luck of the draw.
Hmm.
Um,
Mystery.
and but it's the reality. So the phrase "anybody with lungs can get lung cancer" is sort of the what is a uh, I believe that it's a slogan for the longevity advocacy group, which is an excellent lung cancer group. But one of the problems um, with lung cancer is that there is a tremendous stigma still. People who smoking in relationship to lung cancer. I think the people, when they heard that I had lung cancer, many people, curiously, I mean, they asked, you don't smoke, do you? You know, so it is a common misconception, but it is stigmatizing, and and actually it's one of the reasons why researchers think that people don't get screening
Yes,
for
I was
lung
going to say
cancer
that. Yep.
because there would be they're concerned there would be a stigma to that, to being diagnosed or even screened for lung cancer. I think that my story and that of countless other people who were surprised to get a lung cancer diagnosis are proof that anybody with lungs can get lung cancer. And one more important thing,
Yeah.
the whole issue um, of early screening, and the way that early screening is done is with a CT scan. A painless CT scan, which is able to look and see very tiny, minuscule clusters or things that could be something dangerous. It at least alerts doctors that something seems to be growing there, and then further testing can be done. The thing is that most people, if the reason why you get screened for lung cancer is because you have a symptom, in my case, a nagging cough, if a symptom brings you to get screened for lung cancer, very often it has already spread and is in an advanced stage, because lung cancer, unfortunately, can grow for years undetected in your lung, and you don't know about it until you have the CT scan and the other tests. So if people uh, got screened before they had any symptoms with a CT scan, that could catch cancer in stage 1 or 2, which is a much easier treatment and with a much higher chance of curing the lung cancer.
Yeah, it's interesting you bring that up about screening, because I know on a lot of fronts there's a big push, especially during November of each year, given that it's Lung Cancer Awareness Month, for screening. It goes on all year long, but I know there's a real orchestrated effort, especially during November. But I've, like I mentioned earlier, I've worked with physicians in the space and patients, and I know, at least historically, one big stumbling block is that there's a gap in who qualifies. I mean, if you have like a certain pack year history and you do have a history of smoking, that's obviously that's target. A lot of insurance, every insurance is different, but a lot of carriers will cover that in certain instances because there's a reason to be screened, quote unquote. But in your case, you wouldn't have had, maybe you would have had that reason because you had a family history. But for somebody, there's plenty of people who have no family history and end up getting lung cancer, even though they don't smoke. And so
And
what happens with those folks? You can't,
right, I
a
mean
lot of times
that's a great
you
point.
can't get screened. So
Well,
how would they
you
know? Right.
can get screened, but they won't pay for it. To
Right.
to
Sorry.
to,
You're
to
right.
right to
Yes.
qualify to have your insurance paid for it, you have to have smoked. I believe it's 20 pack years. So 2 packs a day for 10 years, 2 packs a day for 10 years, or 1 pack a day for 20 years. So that's a lot. That's a lot of smoking for you to qualify to get a screening that's paid for. unfortunately, lung cancer advocates will say, you know, lung cancer is very poorly funded. That's what the lung cancer advocates will say, compared to, for instance, breast cancer and having mammograms. Mammograms. Once you're at a certain age, they're a recommended part of your paid for screening, but that's not the case with lung cancer. And so lung cancer advocates are pushing to make CT scans more accessible. They're looking for other ways, cheaper ways. For instance, could a blood test that somebody take screen for to check whether you have a whole bunch of different kinds of cancers. That's sort of what the research is leading toward, to make the screening easier, cheaper, and more accessible.
Yeah, and there's also that surveillance piece of it, right? So like you go in and we'll talk about, in your case, there's you're for the foreseeable future anyway, if I understand correctly, you're going to have to go in and get monitored and make sure there's no recurrence, which I know is a running theme with a lot of cancers, especially lung cancer. And I know recent research. I'm not exactly 100% up on the most recent research, but I know in the recent past there's a drop off where people they finally get in, they get screened, but they don't always keep up with the surveillance piece of it, where and there's a cadence to it, and it varies whether it's 3 months, 6 months. I'm not exactly, like I said, up on the most recent requirements, but be that as it may, I know there's a cadence to it, and there's a big fall off, at least in the recent past. I don't know if you ran into that in your experience. If I know you've been good about the surveillance piece,
Well,
but
but I
is that
mean,
a concern?
but you raise an interesting point, because think about it. I was diagnosed with lung cancer in November. I started one pill a day targeted therapy in December. By April, almost all of the cancer in both of my lungs was gone because of the targeted therapy. In the middle of April, I had a lobectomy to remove the lobe where my main tumor, where it started, was, and within a month after that, there was no evidence of disease. Which is sort of the equivalent these days to remission. Remission is typically blood cancer. NED, or no evidence of disease, is the phrase for a tumor. So within 5 to 6 months, I went from stage 4 to no evidence of disease. Now, that could not have happened if I didn't have an active team that was constantly monitoring. And I would go in there and I would have a test, and it was, this is going well, let's do this. This is going well, let's do that. In fact, I was surprised when my doctor, when I went into my oncologist, when I knew that my targeted therapy was going well, and he said, I've talked with the tumor board, and one possibility, we do think that you're now eligible for surgery. Let's meet. If you'd like, we can meet with your surgeon and see whether surgery, which 4 months ago was not an option because the cancer was too widespread. Now the fact that there was only a little bit left in one lobe, it made it an option.
Oh, that's so
So
interesting.
so
Okay.
so it continued to change, and it was bam, 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 bam. I mean, I'm so thankful that it was, but since then, it has been a whole bunch of aggressive surveillance, as you mentioned. And just to give you a sense of what that is, that would be CT scans. When I started out, that was every 3 months. Then maybe every 6 months, I would have a brain MRI, which looks to see whether there's any spread to my brain, because actually EGFR, that is one of the uh, one of the common places where lung cancer does spread
Oh.
to.
Oh, okay.
So the CT scan, didn't see any evidence of disease. The MRI, the brain MRI, showed no evidence of anything to be concerned of there. A few months after that, I had my first liquid biopsy, also called a blood biopsy. And what that does, in the same way that biomarker testing zoomed in on my particular kind of cancer, this blood biopsy is looking to see whether there's any evidence of the EGFR cancer in my blood. Obviously, it can't test all of my blood at all times, but taken in a blood draw, there was no evidence of EGFR, cancer, which is obviously a good thing. If there was something, then that would indicate that the treatment either hadn't completely uh, gotten rid of it, or that it was coming back, which
Oh,
is a
yeah.
that from the very beginning. Uh, my doctor told me that while targeted therapy is great and really effective and can really reduce or even eliminate the cancer in your body, unfortunately the cancer continues look for ways to get back, and sometimes it finds ways to defeat um, that targeted therapy, and that sometimes includes changing the kind of mutation. So the mutation mutates again. So what was before this EGFR 19 deletion could change to EGFR 20
Hmm.
deletion, and perhaps the targeted therapy doesn't work as well, if at all, with that particular type of cancer, the mutation. So that is sort of the ongoing research that's going on right now, looking for ways to allow targeted therapies to looking for new targeted therapies, but also looking for target ways to flip the switch so that new mutations can't defeat the targeted therapy. In other words, to allow you to continue to use the targeted therapy that is working so well. So that is really the ongoing research, and just in general, learning about my cancer and learning about the research that's going into it, and the treatments that are available now, and the next treatments that are in the works, is very empowering to me, because knowing that there's a likelihood that cancer would come back, it's knowing that there is a plan B and a plan
Right.
C already in place, and reading about new clinical trials about plans D and E that are within a year of being on the market. That to me is very empowering. So rather than focusing on the worst, it helps me to understand that there are options already, and there are more options on the way to help should my cancer return.
So interesting. And like, and you're doing a microcosm of actually what you do across your social media platforms right now so well, which is really educating the public on, not just, your initial diagnosis, but the ongoing nature of your treatment. So my next question is about that. And it's a two-parter. So like I said, you turn to social media, the radio, which is what you're best known for, and even articles on the WTOP website to document your journey. And so I was wondering, what made you want to make those details so public? Because a lot of people, like you said, there's that stigma, and a lot of people even again, after having worked in this space a little bit, I know a lot of patients worry that others will feel like they brought it on themselves by making that leap in judgment that they smoked or something like that. So there's that stigma you talked about. So why did you decide to make the details so public despite that that reality? And also, how did you sort of, was there a plan behind how you made a lot of them are videos and like I said, articles. Was there a plan behind like when you would distribute these, or was it like, for instance, were people asking you questions that you felt like you should address, or was it more just spontaneous and as questions arose or as you thought something was interesting, you would either write an article or make a video? How did that all unfold?
That's a great question as to why and how I did it initially. Um, I felt like, in my job as a reporter, I'm always asking people to share their stories with me.
Right.
I figured that it would be, that this would be a story of my own that I could share. I did know that lung cancer is a very common disease, and I thought, you know, that telling it, letting people know that that was something that I was dealing with now might be of assistance to them. I also was, in the back of my mind before my treatment even started, I thought, well, if I suddenly disappear from being on the air for a couple of weeks, um, I want people to know why that might be. At that, sort of that way of thinking was before I realized that my targeted therapy would allow me to not miss any time from work. That would allow me to just continue living my life as I did before. Um, so each time that I go and I see my doctor and I have a procedure, or I'm facing an important point in my journey, I ask a lot of questions of my doctor so I can understand it. And then I figure that why not share what I'm learning with the audience while I'm learning it. So I think I make it pretty clear that I'm not a doctor, and that these kind of articles are usually written in the first person, so that so this is my experience as I do this. I'm okay with sharing my emotions and my how I'm feeling about that. I think that part of being a reporter, at least on the radio and for WTOP in particular, is we're a local station. We're hopefully the news that we do is relatable to our audience. I know that lots of people either have lung cancer or know somebody who has lung cancer. So I figured it'd be a little bit of a public service to describe what it is that I was learning as I was learning it. What I will say, and I didn't expect this, that the more that I asked questions and explained to others about what was going on with me, the better I was able to understand. I figured if I'm going to explain it to somebody else, I need to really understand what's going on and the rationale behind it. And asking that level of question and coming to that level of understanding was actually beneficial to me, because it helped me wrap my head around what was going on with me, and in explaining to other people that there were options and that there were Plan Bs and Plan Cs. It helped me believe it. And so while very many people have said that, they've kindly said that they've appreciated me sharing my story because they're going through it or a loved one is going through it. It has also benefited me greatly in telling the story.
Yeah, and I've learned so much, and I didn't even, the fact that you're talking about, I think the answer to that question is, was it planned? It does seem like it was, in a sense, you knew what you were getting into. So maybe from that perspective, it was a little planned, but it's also just as things came up and you wanted to not just relate them, but maybe teach a little bit and even teach yourself. That's when you said, okay, this will make a good video or this will make a good social media post. Is
Yes,
that kind of it?
the reports typically are when something new is going on in my treatment. So so I did a report when I was diagnosed. I did a report when my targeted therapy was working well and clearing most of my cancer. Then I did a report when I learned that I was going to that I was eligible for surgery. So this was a possibility. I did a report uh, the day that I was at the hospital, for my surgery. Amazingly, my surgery was on a Friday afternoon, and I went home Saturday at noon.
Wow.
So and uh, on Monday there was a report of me taking a walk on a beautiful on a beautiful spring day, uh, you know 2 days after I'd had lung surgery, but out for a walk, which was part of my rehab. And I was okay with, when in the video, when I'm walking and talking at the same time, I ran out of breath, which is sort of what you would expect from somebody. But that was the purpose of going out for a walk, which was to build up my resistance and build up my lung capacity. And so I thought that kind of, that's a news you can use
Yeah.
type type story. And I thought that having me show that, yeah, okay, so you're out of breath a little bit. I mean, that's, it's letting down the curtain a little bit, but what's the big deal? I'm not, I don't think that it will hurt my news credibility. In fact, maybe it would increase my news credibility if I'm willing to be that honest with the audience.
Yeah, well, thank you for walking us through that process, Neal. And I think it's a creative process, and I think it's a very generous process because you're, like I said, I always wondered sometimes when I was, sometimes I would wonder when I was in that space working if the patients always knew what they were getting into. So I think, if somebody follows you on your both through WTOP and also through your social media platforms, all of which we'll put links to in the show notes, I think they'll get a really rounded and a full understanding of what either themselves or maybe a family member or a loved one or someone to whom they're giving care is really being faced with. So I think you're doing a public service, like you said. Yeah, and like I alluded to earlier, you actually have brought your you did a speaking of creative ideas, you actually brought your care team into this kind of process of like you said, pulling back the curtain and showing kind of the behind the scenes of how all this works. So I know that you interviewed the director of thoracic surgery at the hospital where you were treated, and I know you've mentioned this in passing already, but and also your interventional pulmonologist, whose name was Bobby Mahajan, I believe is how he pronounces it, and
Yep.
also your oncologist. So again, these are all online, and I'll put up videos to links to all of them. But I in particular found Dr. Mahajan really effective in explaining your interactions and kind of the thought process that went into your treatment care plan. So I was wondering if you could talk a little bit about why you decided to feature your doctors so prominently in some of these videos on your, both on the WTOP site, and you talk about them quite a bit on your social media too.
Sure. So this was as I got to the 1 year anniversary of my cancer journey, I was looking to do something that was, somehow things were going well, so I figured that I would interview the doctors, and I had built up enough of a relationship with them over time that I felt like I could ask them questions um, with a little bit more authority than I could have than I would have been prone to back then. Back then I was more afraid than I was a year later because things were going well. they've earned my trust in getting me to the point where I am now. So it took I had to make sure that they were okay with it. I didn't want to put them in an awkward spot of having to having to answer questions about my case. Of course, I had to give them, for HIPAA, I had to give them permission to talk about the specifics of my case. But I feel like I've learned so much um, over the year that um, and as I've learned things, there have been times when something happened, and I thought it wasn't until months later that I learned it. For instance, in my very first meeting with my oncologist, as we were discussing um, um, whether I would start treatment with stage 3 or stage 4, and he was drawing diagrams of my of my lungs and where things already were. He said, "Well, if it's stage 3, it will be the it'd be chemo and radiation with a hope of a cure. If it's stage 4, it would be targeted therapy, and the prognosis would be months. And while and so a year later, with a little bit of time between then and now, I was able to say to my doctor, this was the first time that anybody ever said to me, suggested the possibility that I wasn't going to live, my full lifespan. So, I asked him, why did you say it that way? What was, and he told me that a very important part of building the trusting relationship, is to be honest and caring and supportive, but not build up false hopes. When I started the treatment, he told me that there was a good chance that the targeted therapy would stop working,
Yeah.
and that is that's a scary thing. Knock on wood. It worked well, and I was able to get to surgery, and removing the lobe where the tumor started is an extra step toward making sure, or trying to make sure, that the cancer doesn't come back. Doesn't guarantee it. Could still be somewhere in the in my blood someplace, but by taking where the original tumor started out of the body, that increases the odds. So I've had a series of the doctors have there've been enough things that I've been able to do to increase the odds a little bit each time. So while I don't expect to ever say, to hear my doctors say, "Neal, you're cured of cancer," because I know, and doctors know, that cancer from any stage can return, even though it's considered a cure. I may never have the assurance that my cancer is gone for good. But if I can continue to live healthily for another 50 years, I mean, I'm 65 right now, if I can if I can continue to outlive, cancer coming back, that's good too. That's, I don't think I need to hear, I don't need to hear the phrase, "You're cured."
Right. Yeah, and that whole idea of that patient physician interaction, and how do you build trust, and how do you not make a patient overly scared, but also not overpromise things. That could be like a whole separate podcast episode
Oh yeah.
because that talk about communications. That's right in the trenches. So
I mean, the doctor really has to gauge what the patient wants to hear. For instance, besides hearing that typically uh, the prognosis with stage 4 is months, I've never asked my doctor how long he expects that I'll live. I am committed to being a good patient. I keep getting, I have my aggressive surveillance. I'm learning about the new treatments that are being developed during each of my monthly blood tests and chats with my oncologist. I'll ask if there's any new treatments that he's keeping his eye on. In the last few months, there was, I learned about a, uh, a vaccination which is in clinical trials, and which if it's given to somebody who's already diagnosed with cancer, it can help prevent cancer from coming back.
wow.
So for me on my targeted therapy, that is something that I would like. So I asked my doctor, would that be a clinical trial that I would be eligible for? And he said yes, if uh, it would be. So knowing, having that in the back of my mind, that there already are, some contingency plans in place, good contingency plans, that helps me deal with. I certainly focus more on that, and I pretty much never focus on uncertain. What I think of as uncertainty.
Yeah, it seems like your instincts as a reporter are really doing you good service right now because you're constantly digging and trying. And probably the doctors appreciate that because it's probably everyone's different. The extent to which a person is their own advocate or knowledgeable about their own care just varies so much. There's such a huge spectrum, so they probably actually the just judging on the conversations you've had with them that I've seen, they I would imagine most of them welcome it.
I
But that's
I
nice to
think you're I
have.
think you're I think you're probably right.
Well, yeah. As we wrap up here, Neal, I was just wondering. We've talked a good deal about your treatment and about the fact that you're going to be under surveillance. Probably for at least the foreseeable future until there's maybe a big breakthrough in medicine. So,
Mhm.
with all that as background, and given that this month, like I've said a couple of times now, is Lung Cancer Awareness Month, what advice would you give to people who maybe either qualify for lung cancer screening and who are maybe a little bit hesitant to do it, or maybe who don't particularly or don't think they qualify, but maybe there's a family history or something, but are still even so reluctant to get screened? I mean, what would advice would you give to them to maybe try to get them over that psychological barrier maybe?
Okay. Well, uh, I never, before I was diagnosed with lung cancer, I never thought to myself, you know what, I really need to get screened for lung cancer. Even though my dad had lung cancer, I did not think that I was at risk. I have since learned that that obviously is not the case. Um, I do think that there, obviously you want, you'd like your insurance to pay for a CT scan. I think that there is undeniable proof that when cancer is diagnosed early, it leads to better outcomes. Certainly more cures, and certainly more comfortable shorter and more comfortable treatments. Um, I do think that a lot of you know nobody wants to hear the phrase that you've got stage 4 lung cancer, and then they complete the sentence in their mind, which is the most lethal cancer there is in the United States. But that's the truth. But the reality is that these days, getting diagnosed with lung cancer, while it is still serious stuff, there are so many more options than there were 10 or 15 years ago. There is so much more research and understanding of targeting the exact cancer that somebody has. It has improved so much, and this whole thing about targeted, personalized medicine is continuing not only in lung cancer but in all different kinds of cancer treatments. So a lot of research is being done, zooming in on trying to understand the exact kind of cancer there is, because then you can come up with the way to counter it. And to me, sorry, that is really exciting. I mean, nobody ever wants to get diagnosed with cancer, but I'm sure glad that I was diagnosed in November of 2022 and not in 2023. So if you have the wherewithal to get a CT scan when you're younger than, even if you're not a smoker, if you have a cough which you can't really pinpoint why, you know ask, if somebody in your family has had cancer, tell your doctor, I think that I'm at risk for cancer. I would like you to advocate for me to to have a CT scan done. um, if you can't do that, get a chest x-ray done. Again, of course, chest x-rays are too late for lung cancer, because a chest x-ray was the first thing which indicated to me that I had a suspicious mass in there, and that led to a CT scan. But if I'd had scans before that, then maybe I could have been diagnosed earlier. Regardless, getting diagnosed today is better than getting diagnosed next year.
Mm.
So make that a priority, and take it seriously, and cross your fingers, but feel confident that there really is some great research and science to help people who are living with lung cancer.
Yeah, and thank you for reminding us that there are those also beyond. I characterized it as psychological barriers, but there's real world barriers in terms of resources or access to care, and just the fact maybe someone's not underinsured or uninsured. There's a lot of factors at work there. So thank you for reminding us of that reality as well, Neal.
Sure.
Well, thank you so much for your time. You've been more than generous. If anyone wants to continue this really important discussion online, where's the best place for them to find you, Neal?
Well, at the WTOP.com website, there's ways to email me on Twitter/X. It's at Augenstein WTOP, and I think it's on Threads. It's Neal Augenstein. But then again, you can't send a private message with Threads. But if you want to get in touch, please do. And I've had some great email discussions with people who've shared their success stories, and I'm glad to hear people. I'm glad to be kept up to date on the journeys that people are undergoing. I'm glad to share my experiences with them, and it's a thing, but it is a thing that can be dealt with. So I encourage people to just look it square in the eyes, and I think that you still got a lot of life in you, and and it's a life that you can really enjoy.
Well, thank you for providing such a great example for how people can handle this with grace. I really appreciate you joining us today, Neal. Thank you so much for your time.
My pleasure. It's great talking with you, Chris.
Absolutely.